And then, yep, I'm going to do what I said, which is this. Let's talk about longus coli. And this is longus coli, everybody. Basically from areas of bodies, vertebrae. There. Longus coli. But here's what I want you to get from this one, all right? The details of the muscle, probably not impressive. But what's impressive about this muscle, I'll admit it. I'll admit it. I was like, that's a tough one to do. So with longus coli, when you look, you think about how it is underneath. So like I said, you take your skin off, right, on the front of your neck. Then you take off that thyroid gland, which is right here. Take that off. Then you've got your windpipe, right? With all the cartilage over it and all that stuff, take that off. Then also too, probably what's going to come along with that will be your esophagus, which is a smooth muscle behind the trachea. Take that off. And then you get to this. So yeah, this is not something that we're going to have you palpate. I know in class, when I've done this, actually in a sports massage class, continuing education class, had an instructor that showed us how to delicately move a client's, and I'm not telling you guys to do this at all, but move a client's trachea out of the way to get to this muscle group, the longus coli and the longus capitis, to do work if need be in that area. But I would not recommend it for you guys, but at least understand where it is. It's deep, all right? It is gonna be the person who's holding the ropes for the person that's climbing the rock wall, all right? That's its job. And now with this little buddy, longus capitis, all right, we said longus capitis is going to originate from the TVPs of C3 through C6. And then in that picture that Dr. Osar was showing, you saw like it comes up here, like past the C1 to have an insertion somewhere up here. Where is that? Well, where's George's head? Let's bring it out, everybody. George's head. Woo! All right. Occiput. Remember last week we were like, palpate for the EOP, that bump on the back of your head, right? Right in that midline right there. And then kind of feel out. And we're like, yeah, that's on the occiput. That's why it's called the external occipital protuberance. And the superior nuchal line is a line or a ridge of bone that kind of extends out laterally from that. And that's also on the occiput. And oh, it was all in the occiput. And so a lot of people just think, okay, yep, that's the occiput right there. But if we take the skull and we tip it upside down, this is also all occiput. So in fact, right there, that's that foramen magnum, which is part of the occiput. It's where the spinal cord exits out from the brain, all right, and comes down through that vertebral canal, right? That would be hidden within all your vertebrae. When they stack on top of each other, they create that vertebral canal. So when you see these two little blue dots right there, all right, in this area is where that longus capitis is going to insert onto. Isn't that mind-blowing, everybody? So that's where, because again, if you think about it, with the vertebrae, and I can take two of these off, all right? All right, the vertebrae would be sitting right there. And then you think about the muscle coming off of those TVPs and vertebral bodies and whatnot, and then coming up to attach or insert onto that front part right there. So that too is a deep, deep muscle. It is there to help to stabilize that head on the vertebrae when you're doing movements that the superficial muscles the ones that are climbing the rock wall, so to speak, are actually creating at the head and the neck.
So all I want you to do is feet together, arms by your side, and now just look down at your feet and just get a sense of what that feels like. Do you feel any tension? Where do you feel tension? And just do that a few times. Get a sense of what that feels like. And now we'll go train the deep neck flexors, okay? So you need your towel. So most of us, if your head is not so forward and you're not overly kyphotic, you don't need much more than this, okay? So now what you want to do again is align the top of your head, with your chin. So just watch me. I'm gonna take my towel to create a little bit of a cervical area and a flat area. So that way the chin and the top of the orbit here are relatively well aligned. And then bring the knees up. Put your hands on your rib cage, okay? Now just shake your neck, or when I say shake your neck, very gently rotate your neck, I should say. Don't shake your neck. It's not a good idea, okay? Now, if your client shoulders are all jacked up, which is they have head and neck issues, they probably have shoulder issues, use a strap around their waist. But for right now, I just want you to put your hands on your rib cage, okay? Your neck is relaxed. Very gently bring your chin down without tensing those scalenes. So your scalenes, your front of your neck should be nice and relaxed. So very gentle, chin down, and relax. Very gentle, chin down, and relax. Do that one more. Keep those neck muscles relaxed. And then just hold it down there gently. And now put your hands on your rib cage. Breathe into your rib cage, so side to side and front to back. And as you breathe out, ribs move down towards your feet or towards your waist. There's no motion of your head and neck. They stay stationary. Your ribs are moving down that direction, away from your neck. So that way, as your breath is helping you lengthen those neck muscles. Pulling you a little bit closer here. Okay, so rotate your neck lightly. Make sure it's not gripping. Do a couple deep neck flexions. So that cranial cervical flexion. So you're nodding yes with no superficial tension. Hold it. Hands on the rib cage. Let's do 3 breaths. So breathe in. Breathe in for a count of 3 to 5 seconds. Pause. Breathe out for a count of 6 to 10 seconds. Ribs are moving down gently towards the waist as you breathe out. Do it one more time. Breathe in through the nose. Pause. Breathe out. And pause. And one more time. And relax. And breathe out. Keep that neck long. Keep that neck soft in the front. So that way you're actually teaching the deep neck flexors to stabilize as the ribs are moving and pulling on the neck. So you're getting that eccentric lengthening. You're getting that motor control training. You're developing the deep neck flexors while relaxing and releasing some of that tension in the superficial muscles. Now, we just done a few breaths. Stand up again. Now let's just recheck. Let's just see if we made any difference. Again, it wasn't a lot. It wasn't. We would generally do that for 3 to 5 sets. So just stand with your feet together again, hands by your side, and just check your neck flexion again. And for me, it feels easier. Feels less tension as I go forward. Okay? Not dramatically different, but relatively different.